replace and repeal of the Affordable Care Act, or the ACA. While most Americans are focused on the individual health insurance piece of repeal and replace, what I know is how repeal and replace will affect the job market and, more importantly, our most vulnerable population. The Affordable Care Act does much more than provide health care insurance to millions of Americans. It also provides high-quality care through mandated reporting and approximately 1.2 million jobs both within and outside of the healthcare field. Today we will discuss individual coverage and affordability, the economy, and finally, patient safety. Much of the information I'm going to share with you today came from the Association of American Medical Colleges, CNBC, CNN Money, and the Economic Policy Institute. 14 million people would lose their health insurance coverage within the next year if the Affordable Care Act, or ACA, is repealed under the new proposal Republicans are trying to pass. By the year 2026, a total estimate of 24 million individuals could possibly be without health insurance. These numbers are the newest estimates from the Congressional Budget Office and shows a sharp departure from Republican claims that more Americans would be insured under the new proposal. The truth is that approximately 75% of the folks currently insured under the ACA would lose their insurance. With the proposed new health care reform, two of the taxes under the ACA that target the wealthiest and have no impact on lower-income Americans would be replaced with new tax cuts that would now allow tax breaks for the wealthy. Approximately 7 million households who earn under $200,000 annually would lose their premium tax credits used to purchase private health insurance policies through the government. The ACA repeal also looks to replace income-based subsidies with age-based tax credits. Instead of a subsidy that looks at the price of insurance and income, the age-based tax credit is a refundable tax credit based on your age. Those tax credits do not apply to anyone on Medicare, and the credits may not be enough to make coverage affordable for older folks. Losing health insurance would also be devastating for families and could potentially be devastating for the economy. Normally, you wouldn't think about health insurance and the job growth. However, because of the high cost of healthcare, it is significant to the overall United States economy. The healthcare field accounts for about 1/6 of the entire economy, more than any other industry. It is estimated that the combination of tax and spending cuts would reduce the national job growth by 1.2 million. This job loss would affect all industries, not just healthcare. Loss to affordable health insurance impacts what households spend money on. Patients with chronic conditions who need access to care will more likely have no choice but to spend money on higher cost health insurance, putting less into the economy for services and goods not related to healthcare. One of the purposes of the ACA was to reduce job loss. Job loss happens when an employee is afraid to leave a job that may result in loss of employment benefits, including health insurance. Many Americans before the ACA were afraid to retire or even start a business because of the need for health insurance normally found in the workforce. Due to the ACA, people over 60 could retire, or a single parent remain at home because they could choose one of the many affordable insurance plans under the ACA. Probably one of the most important and more serious part of an ACA repeal are the patients themselves. Without the ability to pay for health care, patients begin to delay or ignore treatment. According to the Association of American Medical Colleges, repealing the ACA without a replacement or a delayed replacement would disrupt care for patients. If patients cannot afford health care coverage, they are more likely to abandon their care. Many programs within the ACA ensure patient safety. Within hospitals, for example, programs under the ACA are aimed at limiting health care-acquired infections. Hospitals in rural areas could be extremely hard hit if the replacement rolls back the progress made under the ACA to ensure patients and incentivize them to get care before their illnesses require emergency room visits or hospitalization. The idea is to keep folks out of the hospital and active in their own care. Living healthier lifestyles that include routine checkups is one way to maintain good health, but people also need access to affordable care in order to accomplish this. The Affordable Care Act, or ACA, does much more than provide health care insurance to millions of Americans. It also provides high-quality care for vulnerable populations through mandated reporting and approximately 1.2 million jobs, both within and outside of the healthcare field. It plays a key role in individual coverage and affordability, the economy, and finally patient safety. Repeal of the ACA without a replacement that addresses basic needs for individuals is not only irresponsible, it is dangerous.